So, do you have a man in your life or a brother or an uncle or a father who they can't tell you when they saw the doctor last? I really notice that there's something going on with their energy or their mood or their maybe sexual kind of approaches and or just in general there seems to be some kind of disgruntledness. Don't worry, please, because we're going to talk about it today. One of the studies that I read that 72% of the men who were surveyed, well over 1,000, said they'd rather clean toilets than go to the doctor. 30 years of working as a nurse practitioner in the medical field and working with these men. Who's here today to talk about it?
How are you? How are you?
I'm great. I'm so here.
Can I interrupt you 1 second?
Yeah.
I still hear that weird echo. Weird echo.
Here is the big deal. I think that's the hardest part. How to get men to be engaged in their health care. That's one of the most difficult things because
usually men wait until
women
they're married.
Go, what's
women
that all
get
about?
socialized earlier in medicine because of their period and pap smears and pelvic exams, breast exams. They get socialized in medicine much earlier than men do. And men are really required until their 20s to have their cholesterol, in their 30s have blood pressure and cholesterol and the sugar levels taken. And everything's based on family history, whether or not you're predisposition to diabetes or some other comorbidities like hypertension, obesity, things like that.
Yeah, and even those, if they have something in their family, I think it's not going to go to their 40s.
And now they still do require every sports player to have a physical.
That's a given.
But a person's not usually given a physical. A male's not usually given a physical until they get married.
They get what?
A physical exam, usually right before or after they get married.
Oh, so when they're getting married.
When I worked in primary care, the husband would not come to the doctor without his wife because.
Really?
Yeah, I don't know. Men just don't remember the names of the medicines, and I don't remember what my plan is. Because women are very detailed oriented and men are not. It's just like men, it was green, I think, and women are like, no, it had lines of green and blue and yellow. Women are very detail oriented and men are not.
When I used to go to my husband's, when his doctor would come, she would say, how are things going? He'd say, fine. Fine. Are you kidding?
And everything was horrible, right?
Worse. It was awful. And I was like, how is her fine? So I think that's part of the problem. Some men are not good at experience.
You minimize things.
Yeah. So how do you get them to at least make the appointment?
I think it's
because there's some things that are happening with men: prostate, testosterone,
fatigue, diabetes, obesity is the big one.
Yeah.
And I think with the GLP and some of the other diet aids, encourage men to go and get weight loss. And that actually causes them to get a physical and everything. People don't want to know they have diabetes. People honestly do not want to know. They don't want to claim it when you tell them, oh, you have diabetes. Oh, I'm not claiming that.
Yeah.
I'm like, what?
I know. True. I remember patients who'd come who had the pain in their feet. One to more about the pain in their feet than the fact that they might have diabetes.
This one male patient of mine, he came back so many times. I said, listen, your hemoglobin A1C is 6.5. And it's 6.8 and 7. I said, whatever you're doing, it's not bringing your blood sugars down. No. You're diabetic and we need to put you on something. Okay, if you have to. But I can cut off the meds, can't I? I said, and they have a wellness program at the prison. Oh, and you have to do so many laps and run and push-ups and stuff like that. And you have to be able to run a certain mile.
I wish they would have a wellness program like that where I work.
Actually, most places do have a wellness program with your insurance plan, but nobody looks into it.
I would prefer that it was something that supported me with a gym membership or something that gave me access.
Do you want to hear something? That's included with your benefit package. Everybody gets it. Everybody. And they expect it too, because they expect to go for 2 weeks and relax in the warm springs or hot springs.
Amazing.
Because they think it's therapeutic to go to mineral springs.
Yes. The data shows very
I was doing
powerful.
research on it. It's expected.
Wow. So that's amazing because I would love it. I remember reading in the recent about these, our medical care is not about wellness. It's about illness. And that's the
That's how we
problem.
bill. We bill for illness. We diagnose illness.
Yep.
Nothing to encourage wellness.
No, that's very disappointing. I know that we get points for wellness when we go to our wellness checkup because I make my payments lower for my health care. If I don't go, and if I have good engagement in my health, I get a lower percentage for my wellness, for
They
my
have
payments.
some kind of wellness check they give you with my insurance. If you go for this wellness physical, you get like $250.
Easy. But I wish they had more of those types of things that encouraged people to show up to the doctor to get that check about your heart, your diabetes, your just general wellness. Because by the time you do need something like your prostate or your
Yes.
testosterone checked,
Wait
you know,
until it's broken.
that's right, which is
Because
too bad.
the old saying, if it ain't broke, don't fix it, or something like that. So they never go to the doctor until they really have something that's falling off or broken.
But that's so sad.
Is
Look at how much time they've suffered. You think about it. When does the prostate start becoming such
around 35 to 40, you start feeling that.
comes the testosterone, correct?
Yes, it starts dropping.
Isn't that when you start to see some kind of
Decline.
dropping in the testosterone
Yes.
levels? What should a man think as far as symptoms?
They do notice it, but no one wants. They don't want to talk about it, Mary Katherine,
Right.
because it's a little demasculating.
Because I'm on here
to say,
reporting.
keep your card.
Or why can't they just say, I'm not feeling the same things I used to feel?
The camp I work with, the patient will say, I really don't want to talk about that nurse is in here. She's a girl. I'm like, she's seen so many men and their problems. I don't want them to know about my prostate and everything. It's very private about their private. They don't even want to show their penis and stuff unless they're taking pictures of it. They don't want the nurse to even to see it. I might have to examine you. Can't you just do it through my pants? I said, no. It's ridiculous, Mary Katherine.
That was crazy. I understand it because I think it's the context. The context of medicine is you're very vulnerable. And I think most men, when it's their penis, it's general I'm in a dominant position around my penis. I'm not in some kind of vulnerable position.
Let the worst thing happen to a man's penis or testicles, and they rush to the doctor.
This is true. Yes. Then there's a definite something suddenly isn't working.
Usually a male patient starts noticing stuff when they're up urinary frequency or nocturia, or their stream changes, eyes or dribble, or they can't start their stream, can't stop the stream.
Oh, so urination is an issue.
That's usually the beginning.
That's the beginning. And that's when,
unless they gain weight or something, that usually forces them to go to the doctor.
Wow. And so what is expected? Are they medicines? Is there?
Since it grows slowly as a man ages, everybody's prostate grows differently, and it grows outward and inward, and causes this stimulation response to your brain that makes you have urinary urgency or feel like you have.
Is it actually putting pressure on the bladder?
No, it's actually putting pressure on the urethra. And it stimulates your brain thinks, I need to urinate.
Brain thinks you need to go to the bathroom.
And so sometimes it will wake a person up to go to the bathroom.
And then there may be no urine.
A little urine. They call it benign prostatic hypertrophy.
And then there's good medicines for that?
There's medicines to relax that urgency, and there's medicines to shrink your prostate. It takes a little while, like a couple of months to the effects of it. Most of the medicines do work. The problem with the medicines it can sometimes alter your PSA results and have to be screened for prostate cancer before you start on the medicine.
So that's really key. Men need to go in and get their prostates checked.
Physically,
all of those things are really key just for general health. And then how do they bring up the issue about testosterone and their erections?
If your primary care doctor is a fairly good primary care, they'll ask you a bunch of questions that will tell him that your T-scores are low.
But can you ask that
restfulness.
test?
Yes, it's like, I
Yeah.
think it's only 6 or 8 questions. And
Oh,
it
okay.
talks about morning fatigue, waking up with an erection, maintaining an erection, having sexual thoughts and things like that. And if you score a certain number, that means your T score is low and you may want to have your testosterone checked.
And does testosterone affect more than just your sexual
Oh,
drive?
yeah. It actually helps strengthen your bones. It helps your metabolism. It helps your energy and wakefulness. Does a lot.
Of course. So that's a really critical issue. Does that, when you start turning 40, doesn't it start to decrease each
Yes.
year?
It does start going down then. 45, 50, it starts declining. Some men, it doesn't go down very much at all.
So how should a woman support her?
A woman is very sensitive and very in tune to a man's performance. And if she notices something in the bedroom, she might suggest, hey, let's go check this out with the doctor. This is not normal. I know that you're embarrassed or you're concerned about it. Let's go check this out. There is medicine, or there is a test, or there is treatment for this.
That seems so direct. You think men will be open to
Let's see. What happens too is men notice their stamina is not as long, or they can't maintain the erection as long, or they're tired all the time. Especially when they used to want it every.
Right. That's a big deal, is the feeling of tiredness. And that to me is a big indicator. So they go and they get their testosterone tested, but what if it's just low, but not super low? Is there something
at least
that
get a
can do?
baseline? And there's certain things that you can do to make it go higher. Losing weight.
Like what?
Decreasing your fat intake, exercising, increasing your muscle mass. Those all increase your
Oh, wow.
getting a good night's sleep.
So basically focusing on general wellness, improving your health, getting more exercise, lifting more weights, all of those things. And then what if it's still?
I would definitely consult my primary physician. I wouldn't try anything because it's usually not clinically tested. If it's vitamin on TikTok, every other ad is about stamina and increasing your penis size.
I know, it's ridiculous. It's like even when you go into the mini marts, so when you fill up your gas, there's all kinds of stuff at the beginning.
What mineral will increase your penis size? That just kills me in 5 days or less.
And when you look at how those things are packaged, Noel, there's some kind of mystery packaged into these multiple things. It's bananas. And it says things like rhinoloceros or
they guarantee if you don't increase size by 2 inches within 9 days, you can have your money back. I'm like,
no, I don't think so. I don't think you can find them to get your money back.
You're right. And it says you have to be careful because your girlfriend's really going to be damaged. That's how bad the ads are horrible.
That is.
But you should definitely have a baseline physical examination, your testosterone level checked, your liver enzymes checked, a lot of things. And one of the things you do.
So is there a better time to get that tested? Should you do it at a certain time?
Yeah, it's recommended go in the morning. I know they have certain cortisol levels and other hormones levels that are done in the morning, but testosterone, he may want to do a testosterone in the morning. He may want to repeat it in a week or two in the afternoon and see. But it's not other hormones where there's an AM and a PM. It's just a random testosterone.
Right.
But it doesn't really tell you how much is available.
And that's really challenging, right?
But if you have significant problems with impotence and stamina, definitely your testosterone should be checked.
If it's low, you're be willing to give you something to help you?
Possibly, if you don't have the other comorbidities like hypertension or something else. The other thing too, there's all these pills for erection. If your stamina is bad, they have all these pills to stimulate your erection, whether your testosterone is low or not. I think it's not safe. Because what if you have hypertension, Mary Katherine, and you're taking over-the-counter stuff?
Yeah. Over-the-counter stuff. Terrible. That's a big risk. Because isn't there cardiovascular components sometimes that are that around testosterone?
Yes, because it uses nitric oxide in order to cause the erection. And sometimes that's not safe.
It's the drug. And that impacts your heart. Oh, I see. So that could be very dangerous. So I think that stay away from things on the counter.
Always consult with your physician about what it is, what kind of drug it is, does it interact?
So it's like first you get your prostate taken care of, then you can what's going on with your testosterone. And then if it is low, then you just do the things that keep you healthy.
Let's say, what's an average age that a man goes to the doctor or should go to the doctor? 30, 25?
By 35 or
Like 30
40.
at least, right? So you need
At
their weight
least.
done, their blood pressure, their BMI. They need to have a visual acuity. They need their cholesterol, their liver enzymes, the chemistry, testosterone level,
Blood pressure.
an EKG,
Yep.
a baseline if
Thyroid.
there's cardiac problems in the family.
Because,
Remember, everything's based on what's billable and not billable. You can't make up diagnoses. And you have to be able to bill for whatever test or procedure you're doing.
So if you have a partner who hasn't seen the doctor, you should encourage them to get a
What if they don't want to go to your
relationship
doctor because you go to a female doctor and he wants to go to a male doctor?
Now
That's a
then
big issue.
we find a doctor who they recommend.
Maybe there's somebody in that whole clinic that you can go to.
Exactly. I think men need to find a motivation to make their health a priority, because more than 80% of men say that their personal and family responsibilities are what potentially can help them adopt things that will be better about their health and well-being. And that's really the key, is that how can we, if we share how much it means to me that you feel healthy and well, and that you're
longevity,
doing
that you're going to stay alive with you as a partner.
Exactly, because that, and think of all the women who outlive men a lot. And it's very difficult. So here's what you have to do. So what would you think is the major takeaway? So I have a spouse who's in his 40s, and I don't know when he's seen the doctor recently. He's complaining that he gets in the middle of the night too much. And yeah, and he's sleepy, and he just feels his morning erections are not the same.
And he doesn't feel rested.
Yeah, the resting part is really critical. It's a problem.
He needs
I think sleep as we get older is hard.
First of all, too, remember, a person has to take the time off. They have to schedule the appointment. They have to see the doctor, have labs drawn, and they have to go back and review them. And it's a very time-consuming thing. I'm sure there's some virtual things that can be incorporated into the doctor's visit, but it is very time-consuming.
I think the key is that if you feel this is a priority, getting a relationship with the primary care doctor is vitally critical for you and your health.
Yeah.
Being that primary care doctor that you can build a relationship with about your health. I'll never forget when my primary care doctor, who I was seeing for 20 some odd years, retired. That was so upsetting.
Some of these areas like Crawfordville and small areas of Florida, there's not a primary care doctor for 100 miles. And in Tallahassee, there was a lot of primary cares that are not taking new patients.
Oh, and this is very disturbing that we have primary care in very rural areas. And so how do you serve these individuals who need to have care? And virtual care can
only takes you so far, but it is.
So I think that the key takeaways is get a doctor that you can see and make the time, make it a priority. Because let's sit. If you can't go to work because your health is a problem, there goes your income, there goes your security, there goes all the things that you're responsible.
Everything. Relationship. It just starts a big ball, and it just gets bigger and gets
bigger.
And you can always put out small fires faster than big ones.
This is true, but you know what? If you keep putting out small fires, eventually everything will up on fire and it won't go out. So that's.
Wait a minute. Give me an example of that.
You don't want to end up in the ER.
What was happening to me? I turned around and my hip was bad. I turned around and my heart was acting up. I turned around and now I have a positive rectal culture. I turned around and I was having a reaction to some drug and having atrial flutter. I didn't get a break for years. I got COVID. It got worse. Yeah.
No, all of it is in relationship to if you had a wonderful, which you do have is a good doctor,
Yes.
good doctor that you really enjoy and have a good relationship with.
She would do
That
anything.
helps
She's
you.
really good.
Can you imagine if you did that to navigate those kinds of problems that showed up? It would have been terrible. It would have been, in some places, just devastating.
Because she's very accessible.
Maintain work, maintain, you could still do things in your daily life. Now you're on the other side of it.
I'm excited.
And that's big. You're
I
on the
told
other
Mom, I
side.
said, the goal is to live rent free.
So, what are things that you have to think about when you're talking to your partner?
And
Come with
usually when you're in a relationship, Mary Katherine, does Lewis do everything you want him to? You got to go to the doctor. Does he say, oh, okay?
Yeah.
Wow. And that's usually how most
Yes,
relationships are.
something. He's not my age, and I think that makes a difference. When someone is a bit younger than you are, then they sometimes are more willing to go, is this important? And I'm like, yes, this is important.
Does he have a good doctor?
You know, he does. He has a very nice doctor.
And he builds, it's not usually the man.
What happened even with my husband before he passed? I organized the whole doctor thing, that barrier, which is a huge one.
I used to have patients, male patients come in and he said, oh, my wife didn't come, so I have no idea what medicines I'm on. I said, you got to be kidding me. You've got to know your medicines. He said, it's too much for me. I said, what if something happens to her? Yes, I'll
Listen.
be with her.
But
I'm serious. You have no idea how many men say that because it's just too confusing for them.
They don't even know the medicines that their children are on.
Their wife usually make them dependent on it, and then it just starts a whole cycle.
Yeah, and that's where we all have to encourage each other to increase our communication, increase our care for each other, and make time and attention a critical part of all of our relationships. I can't thank my brother. You are a wealth of knowledge and make me laugh about our health, which is always a amazing.
Listen, thank you for having me. Thank you for having me.
You're very welcome. So please think about subscribing. Join us here every week. We bring all kinds of information, some silly, some serious. And remember, you have this one precious life. Let's live it to the fullest. So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.